Hi, this is Brandon with ChiroUp. I have a challenge for you. And that challenge is to seek out unconventional thought when it comes to patient care. And the reason I bring that up is that a lot of times patients come in to see us and they've already seen 1, 2, 3 practitioners before seeing us. Maybe it's your medical doctor, maybe it's a physical therapist, maybe it's another chiropractor. In those kind of situations, don't reinvent the wheel. Don't try to have better manipulations in your office. Don't try traction if they've already tried it, medication, exercise. If they've already tried something and it's failed, chances are that person was on the wrong track. That doesn't mean that that care was inappropriate. It just means that that frequency and that type of care wasn't the right care for that person at the right time. I think that if we can really get down and we can listen to what's going on with patients, we can help them and solve their problem without reinventing wheels. I absolutely guarantee, as good of a manipulator and soft tissue person that you think you are, I can find someone close to you who can do the exact same job. So don't outwork them, outthink them. If we look at patients who have plantar fasciitis versus patellofemoral pain syndrome versus a rotator cuff injury, sometimes our recipes, in fact most of the time, our recipes are the best. 8, 9 out of 10 patients get out of pain quickly, are happy with their care, move on, and sing your praises to their community. But what about that 1, maybe 2 patients that you don't get well? That's when we need to step back, we need to listen, and we need to figure out what's going on with that person. That's what makes us great. Those are the patients that build our practice, because now we can go through an unconventional way of getting them out of pain. Maybe it's with that plantar fasciitis patient, listening to where they run. They run on a bank surface. Maybe it's the rotator cuff patient who sleeps on their shoulder every single night and is inhibiting their healing process by that compression and thereby keeping their problem bothering them on a daily basis. Maybe it's something else. Maybe it's something in their lifestyle. Maybe it's their workstation. Maybe it's your hobby, their sport. It doesn't matter. That's what makes us amazing, because we can dig through their life and to find their problems. I work with Dr. Bertelsmann. We're a 2x4 wall away from each other, and I can absolutely guarantee that if you talk to him at the next time you see him at a seminar or out, he will tell you that I never shut up when I'm practicing. I am constantly talking to my patients. 1, I enjoy their company, but 2, I'm trying to find out what's causing their problems. In their initial evaluation, that's a time for them to talk to me, for me to understand their problems. However, most of the time, those patients don't know what's causing their problem in the absence of any kind of a traumatic insult. It's up to you to dig deeper and to find those root problems. If you come to an end of a treatment plan and someone's not getting better and they're still having symptoms, that's when you need to put on your thinking hat. I really think there's 2 different types of practitioners that I see when it comes to this situation. 1 that will try to prove their patient wrong and explain why that practitioner is right and why the patient's wrong. The second, what I think is the most important, is the person who will listen and understand the problem, will swallow their ego to understand why that patient's not getting better. You want to be the latter in this case. Because the more we can learn from our patients, the more we can dig through life, the better off that patient's going to be, and they're going to see that you care about their success. I hope this helps. I know it's not that clinical when it comes to the normal stuff we put out in ChiroUp, but I think it is much more important that we understand what's going on with the patient, they understand that we know what's going on, and then obviously we get out to setting and solving that problem. Look forward to talking to you next week.